Senator Baldwin.
Thank you, Mr. Chair. Dr. Martinez-Lopez, as the department is well aware, the National Guard has become an integral part of our total force, one on which we've relied very heavily for the past 20 years for the global war on terror, and a long list of other missions. Increasingly, we have seen the National Guard activated on short notice to support national priorities such as pandemic response, domestic unrest, and securing our southern border. For the increasing reliance on short notice deployments makes readiness a very key concern for both the National Guard and for this committee. According to the National Guard, over 66,000 Guard members do not have health insurance. Would you agree that providing health coverage to all National Guard members would be an important part of improving readiness?
Senator Collins said the health of the Guardman or reservist or active duty is most important to all of us in the department. And the good news is because of you, they haven't, the first option is the TRICARE Reserve Select. So many of the members of the Guard and the Reserve will have the option to enroll in that program. If we want to expand that program, obviously we're going to have to look more in detail, so what does it imply?
That brings me to my second question. Would you agree that if a Guard member cannot afford TRICARE Reserve Select and they lack access to other forms of health care, that we should find a way to get them covered?
We really need, we need to figure out a way to care for, we need to figure out a way to make the health care that they need available. So,
okay.
Yes, I agree. I don't know how. Obviously, we're going to have to do the studies, but.
We have a bill for you. But additionally, can you speak to any impact to or cost savings for the Reserve Health Readiness Program if we were to achieve 100% health care coverage for members of both the National Guard and Reserve components?
Ma'am, I'm not prepared to talk about that, so I really would like to do a study and look at the background so I can make a formal statement.
Dr. Martinez-Lopez, in recent years, I've sought and achieved increased funding for organizations within the National Guard to hire additional mental health providers and to expand efforts to educate civilian providers on intervention strategies. We have also worked to include suicide prevention as a topic eligible for funding through the congressionally directed medical research program. But despite these efforts, suicide rates have remained stagnant among the Reserve and Guard populations since 2011. Last month, the department released its recommendations from the Suicide Prevention and Response Independent Review Committee. I particularly appreciate the report's holistic view of mental health and the inclusion of factors that, while not directly related to clinical care, nevertheless impact prevention efforts. For example, the report recommends properly funding morale, welfare, and recreation programs, particularly on smaller and remote installations, as well as recommending spousal employment programs. What is your assessment of how we can better apply resources to make progress in reducing this suicide tragedy?
Ma'am, as I said before, the public health approach is the way to go. I personally believe that. As a physician, we need to look at three things. We need to look at the risk factors that are affecting these service members and figure out a way to relieve them from those risk factors, right? If we're not paying them on time, that may increase the risk factor. So we should be able to figure out how to give them payment on time. If there's a family issues, we need to figure out how to deal with those family issues. So we need to look at those risk factors, and we need to look at, from the preventive standpoint, look at ways to decrease them. That's issue one. Issue two, on the treatment side, we need to figure out new ways to deliver the care. First thing we need to figure out is right care with the right provider at the right time. So we have to make that right on target because we don't have that many.
And would you agree that zero-cost health care to all members of our armed forces, regardless of duty status, is an important component of accessing that prevention care and treatment?
Ma'am, I will have to think and see what the repercussions of that before I make a statement, one way or the other. Okay.
Yield back.